Good evening. We'll begin tonight with a developing story. Late today, the CDC confirmed that a man in Texas has just been diagnosed with Ebola. It is the first time the disease that has claimed thousands of lives in West Africa has been diagnosed in the United States. Dr. Jon LaPook is here with us to tell us more. John?
Scott, the unidentified man has been kept in isolation at Texas Health Presbyterian Hospital in Dallas since Sunday. The CDC said the patient, who was not a healthcare worker, flew out of Liberia on the 19th and arrived in Texas on Saturday to visit family on the 20th. On the 24th, symptoms developed. 2 days later, he sought medical care and was sent home. On Sunday, he went to the hospital and was placed in isolation. Now, Scott, we just got off of a live press conference with Dr. Frieden, the head of the CDC, and he made a couple of points. Number one, people who were on the same plane as this gentleman when he flew back from Liberia obviously concerned, but he made the point it is not contagious. Ebola is not contagious until the person has symptoms. So he felt very strongly the people on the plane were not in danger. Two, you wonder about from the 24th to the 28th, he was sent home before he came back and was put in isolation. He did come in contact with a handful of people, and again, it's reassuring to know that it's directly spread only by direct contact with fluids. So specifically, it's not spread through the air. And the CDC is going to be contacting the people who he came in contact with and following them, making sure that their symptoms are followed. And finally, people worry about, could it spread here widely in the United States? And the CDC, again, Dr. Frieden very firmly says, this is not Africa. Here we have a very robust healthcare system. Yes, it's expected and they prepared for people coming here, but they're going to isolate these people and they're going to very specifically follow their contacts, and with that, it should be contained.
He said there was no doubt that this case could be controlled and would not spread widely.
Yes.
John, thank you very much.